Today we are inserting and removing a indwelling urinary catheter. So the first thing I would do would be to check the medical record and see if there are any physical limitations to the patient and for the need of a urinary catheter. I would walk into the patient's room, introduce myself, and identify the patient. I would also close the curtains to maintain privacy. I would put on clean gloves and ask the patient if she has any allergies to latex, iodine, or any other things in the procedure. Alright, now I'm gonna uncover as much as what I need at the moment on the patient. With a normal patient, you would assess their ability to ambulate or move, but this is obviously a mannequin, so I have to move her. I'm going to put the legs 2 feet apart, or I guess the knee is 2 feet apart. And then I'm going to put a drape underneath. This is to prevent any water from seeping down. In the video she had disposable wipes, but we have a washcloth and a wash basin. So we are going to pretend that it is multiple disposable wipes. So I would first start from the inner thigh, dispose, and then go to the inner thigh and dispose. And then I would move to the outer area of the vagina, making sure to go from top to bottom, dispose, top to bottom, dispose, and then in the middle, dispose. And since this is technically a washcloth and a wash basin, I would have to allow time to dry. It is dry now. So I would then uncover her, remove my clean gloves, alright, and now I'm going to start with my when donning sterile gloves, I'm going to put it on my dominant hand first. Alright, now I'm going to put it on my non-dominant hand.
I feel like when you do it in practice too, though, you'll feel better after you've done it a couple of times. They're gonna really feel it. Yeah, but
Alright, and now I'm going to prepare the tray for cleaning. Going to open up the hydrogen peroxide, put that over the cotton balls, dispose. I'm going to open up the lubricant, put that in its designated tray, dispose, and then I'm going to open up the catheter. I'm going to lubricate the first 2 inches of the catheter and attach the syringe. set that aside until I need it. And now I'm going to start cleaning the vagina from the outside at the top to the bottom. Dispose. Dispose. And then one in the middle. And dispose. After that area is all clean, I am going to take my non-dominant hand and spread apart the vagina. I'm then going to take my urinary catheter and I'm just going to insert that until I feel resistance. And before I do this, I want to make sure to let the patient know that she needs to bear down like she's about to pee, and that it might feel like a little bit of pressure or pain. At this moment, I feel resistance, so I want to pull back and inflate the balloon. Once I'm sure that it's in the bladder, and then after inflating the balloon, I need to pull back a little bit to make sure that there is resistance and that it is not too loose inside the bladder. So I felt resistance, and now it is time to remove the syringe that blows up the bladder. I would then clean up my supplies. Attached to her leg. We don't have the strap with us to attach it to her leg, but that's what you would do in the normal setting. And then I would make sure to attach the bag to the side of the bed, hanging down. Just attach it that way. All right, and then for removing, should I take this off first? These gloves.
Yeah, and just act like you're done with this procedure, being like, I documented, I checked the color of the hair.
Okay, yeah. All right, and then I would just make sure to hang the bag from the edge of the bed. Afterwards, I would clean up my area. Take off my sterile gloves. Document the procedure and how the patient reacted, and then I would also document the amount, color, clarity of urine, and just the gauge of the catheter. I would also perform hand hygiene. And now we're back to remove the catheter. So I would first wash my hands, put on clean gloves, all right. I would first attach the syringe This syringe would normally not be filled with water, but since we are not allowed to put the water inside of the solution inside of the balloon, it's still in there. So I would draw up on the syringe and remove any water from the balloon. I would then let the patient know that they're going to feel some pressure. I would tell them to bear down and then slowly remove the catheter. All right. After this, I would discard of the catheter in the bag, document First, I would clean the patient if they had any spill of pee after the removal, and then I would document the procedure, how the patient reacted,